Lisinopril has a hypotensive, vasodilating, cardioprotective, natriuretic effect. Why is this medication prescribed? Lisinopril is used alone or in combination with other medications to treat high blood pressure in adults and children 6 years of age and older. It is used in combination with other medications to treat heart failure. Lisinopril is also used to improve survival after a heart attack. Lisinopril is a class of medications called angiotensin-converting enzyme inhibitors. High blood pressure is a common condition and when not treated, can cause damage to the brain, heart, blood vessels, kidneys, and other parts of the body. Damage to these organs may cause heart disease, a heart attack, heart failure, stroke, kidney failure, loss of vision, and other problems. In addition to taking medication, making lifestyle changes will also help to control your blood pressure. These changes include eating a diet that is low in fat and salt, maintaining a healthy weight, exercising at least 30 minutes most days, not smoking, and using alcohol in moderation. How to take, course of administration and dosage. Inside, 1 time per day in the morning, regardless of the meal, preferably at the same time. In arterial hypertension, patients who do not receive other antihypertensive drugs are prescribed 5 mg 1 time per day. If there is no effect, the dose is increased every 2 to 3 days by 5 mg to an average therapeutic dose of 20 to 14 mg per day. Increasing the dose above 14 mg per day does not lead to a future decrease in blood pressure. The usual daily maintenance dose is 20 mg. The maximum daily dose is 40 mg. The full effect usually develops after 2 to 4 weeks from the start of treatment, which shall be taken into account when increasing the dose. With insufficient clinical effect, it is possible to combine the drug with other antihypertensive drugs. If the patient received prior treatment with diuretics, then taking such drugs shall be stopped 2 to 3 days before the start of the use of the drug lisinopril. If this is not possible, then the initial dose of lisinopril should not exceed 5 mg per day. In this case, after taking the first dose, medical supervision is recommended for several hours. The maximum effect is reached after about 6 hours, since a pronounced decrease in blood pressure may occur. In renovascular hypertension or other conditions with increased activity of the renin-angiotensin-aldosterone system, it is also advisable to prescribe a low initial dose of 5 mg per day under enhanced medical supervision, control of blood pressure, kidney function, serum potassium ions. The maintenance dose while continuing strict medical supervision should be determined depending on the dynamics of blood pressure. With persistent arterial hypertension, long-term maintenance therapy of 10 to 15 mg per day is indicated. In chronic heart failure, the initial dose is 2.5 mg per day, with a gradual increase after 3 to 5 days to 5 to 10 mg per day. The maximum daily dose is 20 mg. Acute myocardial infarction as part of combination therapy. In the first 24 hours, 5 mg, then 5 mg every other day, 10 mg 2 days later, and then 10 mg 1 time per day. The course of treatment is at least 6 weeks. In case of a prolonged pronounced decrease in blood pressure, treatment with the drug shall be discontinued. Diabetic nephropathy in patients with type 2 diabetes, lisinopril 10 mg is used once a day. The dose may, if necessary, be increased to 20 mg 1 time per day. In patients with type 1 diabetes, the dose is the same, who may not be able to take lisinopril. Lisinopril is not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to lisinopril or any other medicine. Are trying to get pregnant, already pregnant or breastfeeding. Are having dialysis or any other type of blood filtration. Have heart, liver or kidney problems. Have unstable or low blood pressure, have diabetes, are going to have a major operation, surgery, or general anesthetic to put you to sleep, have recently had diarrhea or vomiting, are on a low salt diet, are going to have desensitization treatment to reduce your allergy to insect stings, have a blood problem, such as a low white blood cell count, neutropenia or granulocytosis. Can I drink alcohol while taking lisinopril? Drinking alcohol can increase the blood pressure lowering effect of lisinopril, which can make you feel dizzy or lightheaded. During the first few days of taking lisinopril or after increasing the dose, stop drinking alcohol until you see how the medicine affects you. If lisinopril makes you feel dizzy, it's best to stop drinking alcohol while you are taking it. What side effects can this medication cause? Lisinopril may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Cough, dizziness, headache, excessive tiredness, nausea, diarrhea, weakness, sneezing, runny nose, decreasing in sexual ability, rash,